Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are simplifying inverse relationships.
Before we get started on this awesomely complex topic, we invite you to subscribe to our live videos. So if you click our face there, you can actually subscribe so you'll be notified if you're on social media and we happen to be live. You can also subscribe to us on our YouTube channel. Like and share this video with your nursing friends. Be sure to follow us on our Facebook page. We give away tons of free content there. And check out our website at www.N-Powermentnursing.com, where you can view our complete study packages and also download the cardiac chapter of our textbook for free. So today we are talking about inverse relationships, and Linda's just going to talk a little bit about what that means.
What is an inverse relationship? If you take a balance scale, if you lose one, you become the other.
So this means that one goes down, the other one automatically goes up. If this one goes up, this one automatically goes down. They directly relate to one another. So there's so many inverse relationships that you learned about in nursing school. Perhaps you didn't even realize at the time because they weren't necessarily all put on one page for you to look at. They're kind of mentioned randomly, that this and this share an inverse relationship, that and that share an inverse relationship. And it's really hard to solidify that kind of in your mind and have an overarching idea of what exactly shares an inverse relationship. So today we're going to share just some of the ones that we go over in our complete textbook. Our textbook is full of inverse relationships, and this is because inverse relationships are fundamental to you understanding content critically in a way in which you can apply it. So we like to simplify that down, because on your registration exam, they're not necessarily going to say, hey, sodium and potassium share an inverse relationship. So this disease will cause high sodium. So what's going to happen to the potassium? It's not that black and white. They just give you a disease. You have to know that it would increase sodium or decrease it, and therefore you would also have to know 2 levels of knowing that it would also affect potassium, because you know fundamentally that sodium and potassium share an inverse relationship. So we're going to give you examples of some of these things and how they translate into content knowledge. So the first one we're going to talk about is sodium and potassium. So sodium and potassium, very, very important electrolytes, because they both, among other things, but primarily affect the heart, especially potassium. So if you have sodium here and potassium here, if you lose sodium in your serum levels, potassium goes up. If you lose potassium, sodium automatically goes up, okay? So what's an example of this? An example being Addison's disease. So Addison's disease is a lack of steroids. If you have low steroids, you also have low sodium. If you have low sodium, you automatically have high potassium, okay? The opposite of that being Cushing's disease. So Cushing's disease is high steroids. If you have high steroids, you have high sodium retention. If you have high sodium, you automatically have low potassium, because they share an inverse relationship, okay? Another example of this, calcium and phosphorus. So if this is calcium and this is phosphorus, if somebody has high levels of calcium in the blood, what you can do is low levels. Take it back a second. If somebody has low levels of calcium in the blood, what you can actually do is give them phosphate binding drugs. So you give drugs that bind phosphate, take that out of the body, and that will actually force calcium to go back up to normal in the bloodstream. That's just an easier example, which is why I swapped that out. So calcium and phosphorus. You can also play with calcium and giving phosphorus-rich foods. So if calcium is low, you give high phosphate foods. If the phosphate goes up, the calcium goes down. You give high calcium foods, the calcium goes up, the phosphate goes down. So knowing that those have an inverse relationship is super important. Another example is sodium and water, and I'm talking about serum sodium concentrations. So if this is sodium and this is water, okay? If you add water, sodium concentration goes down. If you take water away, sodium concentration goes up, okay? Because you're diluting it down or you're concentrating it by taking away water. And the last, probably the most important, most relevant, most highly tested, is every student's worst nightmare, my favorite personal thing to teach, acid and base. When it comes to acid and base, what you need to understand is that you lose one from the body, your body becomes another. How does this translate into content? If this is acid and this is base, If you vomit stomach acid out of the body, your acid goes down, you become basic, okay? The inverse of that, if you have diarrhea, say you have C. diff and you're losing base from the bowels, base goes down, acid comes up. So the body will become acidic. And that's because acid and base share an inverse relationship. So while there's so many different examples of these inverse relationships, we really hope that having just a few examples of these will really help simplify this for you, because you have to understand loss of one causes gain in another, because it's not always going to be that straightforward. So knowing these will really help you get to the right answer, because it's not just content, it's about critical understanding and application of that content.
If you are looking to gain all the content, critical thinking, and confidence you need to pass your NCLEX or CPNRE exam, we have complete NCLEX, NCLEX-PN, CPNRE, and bridging course packages. We guarantee you will pass or your money back. Thank you so much for joining us. See you next time on In the Know. Bye for now.